Welcome everyone. In today's video, we are going to see what is dental floss and how to use it. So lockdown is going on. We all tend to eat food and food gets to clogged and or stuck up. So we should be aware of certain things as to how to keep your oral hygiene, maintain your oral hygiene and keep your oral cavity clean. So I'll be dealing with dental floss today. I have two examples here. One is Colgate dental floss and another is Oral-B dental floss. So these are the two most readily available in your mostly chemist shops near you. Another dental floss is one that comes, it's around 1.5 inches long. It comes in a plastic handle. Even that you can use. It's just a disadvantage is that it has a plastic and you cannot really use it in all the teeth. So we'll take around 12 inches thread. I have used cotton thread here as an example to show you, So it's around 12 inches. Why we are taking 12 inches is if you take less than it will be very difficult to hold it. You cannot really wrap your fingers around it and then use it on your tooth. So it's better to have it longer. How much longer? You can take it, but we say at least 12 inches. You can take it more, but it will be a little clumsy to handle it. So minimum 12 inches you should take, otherwise you will just be struggling with it. So take this much thread, wrap it around your fingers, in your index fingers, okay? And whatever area you're going to use, just taut it with your thumbs. The floss should not be very loose, just keep it taut, okay? So what are the advantages of dental floss? The major advantages in people who have tight contacts. For example, for people who really cannot brush in between their teeth, people who have teeth with crowding, that is the teeth आगे पीछे दांत हैं, उनको बहुत helpful करता है. And I personally enjoy doing flossing because once you do flossing, you'll feel how much plaque you have dislodged. One you could not dislodge with the help of your brush. Okay, and the next thing is इसका और कहाँ करना है? People who have got their root canal treated tooth and they have their crowns on it, जिनकी cap लगी हुई है दांतों पे, for them it is very much advisable. Why? Because when you have cap and you have root canal treated tooth, you would not get to know when your tooth is getting infected because it is essentially dead. So it is for your maintenance of gingival health and so that caries does not start in such teeth. It is a very essential part of the oral hygiene for such people. So make sure if you have any RCT treated tooth, make sure you're doing dental floss, you're keeping good oral hygiene and your gums also clean and there's no caries in your root or side part of the tooth. So that is very important. Another thing is why we cannot use a normal thread. I did have used an example of this dental thread, cotton thread, but you cannot use it in your mouth. Why? Because this is not very smooth. The dental floss on the other hand is made only to be used in your oral cavity. So it is very smooth, it's waxed and it is smooth. So even if you put little force, your tissues will not get lacerated. With the cotton thread, which is rougher, the laceration is a very common thing observed. So it is not recommended as such. So this is about dental floss. We'll be seeing it on a patient now. Okay. The aim here is to clean the space between the teeth. So we'll take around 12 inches. We cut it. You can see the cutter here. I've sanitized my hands. We'll take the thread, wrap it on your fingers. We'll ask the patient to open their mouth. Now, please note that I have made the thread little taut. Don't make it loose. Use your thumbs to make it little tauter and go between your teeth. Can you see plaque? Yes. So you have to brush it out or mechanically try to displace this plaque and then you pull it outwards. Okay, so like this you go around doing in every teeth. See, we'll go towards the gingiva, we clean it out, then we'll pull it back. We'll go back, we'll go towards the second half of the gingiva, the other tooth, and then we'll pull it back. So similarly, you have to go in for all the teeth slowly. I am doing on somebody else. You have to do it on your own teeth. Okay. So this is the basics of the floss. We'll see you later in the next video.